Yorkshire Ambulance Service. Which number should you call when you have a healthcare need? At Yorkshire Ambulance Service, we strive to provide patients with responsive, effective and appropriate medical care. You may already have heard of the two numbers you should be using, 999 and 111. But the one to call depends on whether or not there is an immediate medical emergency. Importantly, if someone has a serious or life-threatening illness or injury, you should call 999 straight away. This could be for symptoms like severe chest pain, difficulty breathing, unconsciousness, or major trauma. When you dial 999, you will be asked which emergency service you need by an operator. Choosing ambulance will connect you directly to one of our trained call handlers. When your call connects to Yorkshire Ambulance Service, we will first ask you 5 important but quick questions so that we can rapidly identify the severity of the situation. Is the patient breathing? Is the patient awake? Tell me exactly what's happened. What's the address of the emergency? What is the telephone number you are calling from? As you answer and the information is captured by our call handlers on the system, keywords will be identified quickly so that we can arrange help at the earliest opportunity. This happens in the background during your call, so answering these questions will not delay our response. You may then be asked further questions about the patient's condition once triage has started. If you have called 999 but the patient's condition is not immediately life-threatening, you may be referred to one of our clinicians or healthcare partners for advice over the phone. This can be while an ambulance resource is travelling to you. If we assess that no ambulance is necessary, you may be referred to another service, such as your local GP or urgent treatment centre. The 111 number can be used if you need urgent medical help, but it's not a life-threatening emergency. Calling 111 will connect you to a health advisor who can direct you to the best place to get help if you cannot contact your GP or if your GP's surgery is closed. Similar to calling 999, you will also be asked a series of questions by our health advisor: who you are, where you are calling from, why you're calling, and whether the call is about you or someone else. Based on your answers, the health advisor may give you self-care advice to follow at home, refer you to another service, such as an urgent treatment centre or GP, arrange a call back from a healthcare professional for a more detailed assessment, book an appointment at a different service, like a hospital emergency department, or arrange for an ambulance. While 999 and 111 are 2 ways of receiving medical assistance, don't forget, you can also visit your pharmacy, GP, urgent treatment centre or hospital emergency department. Patients who may prefer a convenient alternative to calling 111 can also visit NHS 111 online for the same advice, either via the NHS app or by visiting 111.nhs.uk. For more information on the range of services, please visit nhs.uk/NHS-services. By calling the right number for your healthcare need, you can help us provide responsive, reliable healthcare to our patients and the community. Visit our website to learn more about your healthcare options and to find out about our non-English and British Sign Language services. Make the right call today. Yorkshire Ambulance Service. Great care, great people, great partner.